you have a huge number like 662 million females, even in 2020 estimated to go up to maybe 800 million by 2050, out of which 30 to 40% are in that 35-40 plus age group right now. All of these topics about periods, menarche, menstruation, sanitary pads, menopause, vaginal health. Forget vaginal health. Vagina itself is like a very big taboo word. You can't say vagina aloud. And I mean, if you go to the, even if today, if you go in 2022, you go to that shop to buy sanitary pads, they'll wrap it up in that newspaper and put it in a plastic, black colored plastic bag, as if like, you're taking a bomb home with you. So I mean, there's a lot of, even when you come home, you'll keep, take it slowly and keep it in your cupboard so that no one can see it. There's a lot of taboo behind all of these things. And look at it, we go through this taboo is about something which all of us face every month. So every month for 4, 5, 6, whatever days you have your periods, and yet you don't talk about it. You're not supposed to talk about it. This not talking about it begins from when a girl starts her periods, and it goes up to the time when you actually stop your periods. That is your menopause, and that is what we are here to talk about today. So if you could see the slide, we have these stages of menopause. Pre-menopause is when you're having periods, it's your reproductive phase. And then before you actually reach menopause, which is the time when you don't have periods for 12 months at a go. Between this pre-menopause, like normal periods and menopause, is that stage in middle of perimenopause. So perimenopause is a time when your body is slowly easing into menopause. So menopause is basically when your ovaries stop producing the eggs every month. So there is some erratic egg production, so erratic ovulation happening. Sometimes you have heavy bleeding, sometimes you don't have periods for a couple of months altogether, then you suddenly start getting periods. You also start having all of those symptoms of menopause. You start having them in your perimenopause itself. And beyond this, you get your menopause. It's 12 months of no periods when we say that, yes, you've finally come to menopause. And then after that is the period of post menopause, which is the time period that we are spending uh, after you've had your menopause. Now, again, a very common question asked by women who consult me at Elda is, when do I get menopause? So will I, the average age is 46. Will I get it at 46? No, that's the average age. So your menopause depends on, it's genetics. So it depends on the time your mother got her menopause. If your mother got her menopause early, you might get it early. If she got it late, you might get it late. So it's genetically determined, and plus there is no real way that we can predict when you actually are going to get menopause. So the best solution for that is to be prepared. Now, again, when we're talking so much about menopause, okay, it's a phase of life. It's a natural phase of life. जैसे menstruation होता है every month, वैसे menopause आ जाएगा. So why are we talking so much about it? Why is it so significant? Because if you see this graph, which is by the Indian Menopause Society, our life expectancy is increasing. Olden times, maybe around the 1900s, the life expectancy was some 35, 40, 45 years. Now, and on an average, we live for around 70, 80, 90, even 100. People are reaching 100 also these days. So if you consider that age of maybe 46, 50 when you're going to get your menopause, you see that you are living 1/3 of your life in your after your menopause. So I mean, it's going to be it's the time which is, you're free of your responsibilities mostly. You've done your career, you've reached wherever you wanted to reach. Your kids have, flown the nest, the birds have flown the nest. They are doing whatever they want to do, what you wanted to do, and now is a time when you have this time free for yourself. So one patient herself pointed out very clearly to me that these are my golden years and I want to enjoy my golden years. And that was so true. I really liked her saying that yes, these are truly your golden years. So if 1/3 of your life is going to be in menopause, should you not know about what to expect in these years, in this 1/3 part of your life, in this golden period of your life? So what do you expect? So this is again a common question, I think, which is asked by a lot of women, that yes, okay, we know about menopause. So what is it that we can expect in menopause? What do we what should be aware of? What should we be prepared for? So very often, Richa, these symptoms that we have about of menopause, these symptoms are going to they're going to overlap the time when you are also aging. It's going to overlap the time when uh, you're going to have symptoms or the problems related to aging as well. But if you look at these symptoms, of course, period related symptoms are the commonest ones that you face. You could have irregular cycles. You could have periods after every 1 month, 2 months, 3 months, even 4 5 months or so. On the contrary, you might also have periods every 15 days or so. You could have more frequent periods. You can either have scanty bleeding or you could have heavy bleeding, which is not stopping. It goes on for 5, 7, 10, 12 days together. Along with all these issues about bleeding that you also might have, there are a lot of other symptoms also which you face in menopause, so or around your perimenopause. So one very common one is hot flashes. So typically in some studies we saw that some 30% of women complained of hot flashes. Some studies went up to 70-75% also. So probably what I also very often notice in my consultations even at Elda is that people are people don't know what exactly is hot flashes. So that's why they don't identify that, yeah, this is what I'm facing, this is a problem, it's related to my menopause. So what happens typically when you have a hot flash is that you're sitting in a normal cool room with like, maybe a few people along with you, and you suddenly start feeling hot. The feeling of heat can come from behind your neck or your head. You typically sweat. You have feeling of heat and flushing on your upper body. Then you have sweating. It might be followed by a sudden chill that you feel. So this is a hot flash, and yes, this is because of menopause, because of the lowering levels of estrogen that we notice that we have in menopause. So that is one symptom that you have. Mood swings, I'm sure. I mean, I don't think anybody. I mean, I would say somebody who has not experienced mood swings is really, really lucky. So it right from having it around menopause or perimenopause, you also very often have it, just before your period. So premenstrual time is also a time when you have mood swings. You suddenly get angry. You suddenly feel sad, you feel like crying. All of these mood swings keep on happening, which again are because of the fluctuating hormone levels that you have. Tiredness, I mean, people complain of a lot of tiredness. Of course, this complaint has really increased, Richa, especially after COVID, because it is kind of overlapping with the symptoms of post COVID syndrome as well. So people have a lot of, like, women have a lot of tiredness, towards the end of the day especially. They are like, oh my god, I can't function, I just need to sleep now. And these are, I mean, you've been doing all of these chores for the rest of, I mean, like the previous 10, 20 years of your life, and suddenly you find that, no, I mean, I can't cope up with all that is happening around me. Hair fall, I think this picture, of this hand and that comb and hair, I think everybody has experienced it at some point in their life. You comb your hair, and like your hair, your hand or your comb is full of the hair that you've shed. So again, hair fall is an extremely common symptom that people face, especially around your perimenopause. Headache is something that some women might have, especially before they get their periods in their time of perimenopause. Sleeplessness. So sleeplessness, either you can't get to sleep, or you get up sometime at night, and you keep thinking or whatever, and you can't get back to sleep. So your sleep quality is affected, your sleep, the amount of sleep is affected. The next day is affected because it all is, all groggy, and you're sleepy the next day. But if you again sleep in the day, you are scared that you won't be able to sleep at night. So it becomes like a vicious cycle, and it can really impair your performance and your daily activities because of these sleep issues that you face. Again, joint pains. So joint pains are like I mean, you have your back is aching, your knees are aching, your feet are aching. It's like a combination maybe of you're gaining weight. I think an extremely important and extremely common symptom that people see around menopause. So you're gaining weight, your muscles are not strong, they are also getting weaker because of your age. Your bones are getting weaker because as you enter into menopause, your bones start losing their mass. So the density of bones is going down, so your weight is increasing. Your muscles are not strong, but because your muscles are not strong, the bones bear the brunt of your weight. And then the bones, the weak bones that bear the brunt of your weight, are the ones that when you end up having a pain in your joints and your feet and your legs. So joint pains or body aches are again a very common symptom. Vaginal dryness is something which people don't speak about very often. Sometimes when women come and ask for certain other issues, like they're having bleeding issues or something else, and then when I ask them upfront that are you suffering from this, so then they say that yes, actually I am suffering from that. So again, being that taboo topic, people are not very women are not very open about it. They don't really want to talk about it upfront. I mean, your vaginal dryness can be leading to painful intercourse that you might be having. There could be frequent urinary infections that happen because of this vaginal dryness, because because there's no lubrication, so there's small micro abrasions that keep happening around your vagina. Also, your urinary tract, because that is also influenced by the levels of hormones, that is estrogen in your body, and then that leads to frequent UTIs, frequent vaginal infections as well. So these are like some of, I would say there could be, there are some more as well. One is bleeding, of course, there is your bones are getting weaker. But these are some of the most common symptoms that you are, facing around your menopause. So I mean, it's good for you all to open up and say it, because this makes you aware that yes, these are the symptoms that you are facing. It's the first thing is acceptance, getting aware that yes, these are the symptoms, and
Yeah,
accepting that yes, I have a problem and I want to solve that problem. So what can you do about all of this? So first is awareness, that like we spoke of. Then the support. Now if you like, a lot of women who also say that I am suffering from this. I just had a patient yesterday at Elda. She's like, yeah, I have two sons who are like, one is 23, one is 21, and they keep on saying, कि mama, आप तो आपका तो हमेशा चलता रहता है. You keep on, you आप सब सो जाओ. It's not that. I mean, she's not being lazy. She doesn't want to be irritating or irritable, but it's something that she's going through and something that she can't help. So that kind of support that you definitely need from your family members. It could be the support that you need from your peers, your co-workers, your colleagues also, if you are facing some of these symptoms in your office as well. Some kind of empathy, that yeah, I understand that you are going through this, and I want to help. In what way can I help you? Somebody asking you that, or you upfront going and asking for help. We are so, I mean, comes Women's Day and you have all those pictures of a woman like a Durga doing, I mean, cooking one side and managing children one side and working on the laptop one way and cleaning something. Why should you do that? Why should you not ask for help, especially if you need help? Yeah, so you definitely need to ask for help as well. So just how that, you people should ask you that yes, do you need help? Maybe they don't want to, or they don't know that all of these. So just like women are unaware of these things, men are even more unaware that these things can happen. So if you open up to them and say that yes, I'm facing these problems and these are legitimate problems and this happens to women and I need your help, I can't do everything. That is when that asking for help from your co-workers and your family is something which can definitely help ease this process of your perimenopause and menopause. Apart from this help, of course, is professional help. So what is important about, like, the whole point of discussing all of these symptoms is that there are solutions to most of the things that you're going through. It could be medicines, it could be lifestyle management, it could be your managing your exercise, your diet and everything. So there are solutions, and very often I've also seen that from coming from women, that they say that I know the solution. So for something like weight, I know the solution, but sometimes you need a push in the right direction. Sometimes you just need someone to come and ask you empathetically that, better, have you done this, and do you need help in doing this? Sometimes that kind of help, that empathetic help which comes from professionals, is also something that you do need. So I had a lady who would come to me. She was around 45 years old, and she was working professional. And she complained of having irregular periods. She's like, I'm tired of carrying a pad with me every time. I don't know when my periods will start. My purse always has an extra pad in it. She was gaining weight. Her clothes were not fitting her. It was making her feel. I think one person had written, "Your looks go away." Yeah, Payal. So you have these body image issues also coming up, that why am I looking like this? I can't wear what I want to wear. I don't look good in when I wear what I want to wear. So she was facing that problem as well. She was unable to sleep because of the lack of sleep. The next whole day was going away in a blur, that she was feeling sleepy all the while, unable to work good in a good way, or in an efficient way in her office as well. She was having hot flashes. They came up, she said, in between meetings, or when she's talking with her colleagues or so. It made her feel embarrassed, why she's sweating so much. And she was really very troubled by all that she was going through. And again, if you see next slide. So what did this lady, what did she need at this point in time? She needed some kind of understanding from people around her, that yes, we understand, we are going through this, a support and some kind of help. That do you need help in something, in managing something? Do you want your help, as our help in you know managing your work? If you're not feeling well, if you're having some issues, some kind of empathy from her co-workers also, that yes, we know that you're going through this, and we would like to support you in all of that. And of course, when I told her, you also need to ask for help. You can't keep on doing everything all the time. And I mean, a woman is supposed to be the best housewife and the best mother and the best daughter and the best person at work as well. So you need help. Sometimes you need help, to help from your people around you, and you need to learn to ask for that help. So I think, like, starting with asking for help, she started feeling a little better, and she's like, yeah, in the follow-up conversation, she said that yes, since I spoke to you, I've delegated my work to other people around me, and I somehow it feels better. I don't feel as tired, I don't feel as overwhelmed as I used to feel before. This was one lady. Let's take another example. So this another lady had come, who was 60 years old woman, and she had retired from her work, and she was menopausal since the last 5 years. And she was having a lot of weight gain. Again, she's like, yeah, I know everything. I searched the net. I know this, that. I have to do this. I have to have that calorie deficit. Exercise करनी चाहिए. खाने पे ध्यान रखना है. I mean, that knowledge is there, but implementing that knowledge, there was some kind of lethargy, and some kind of lack of motivation when it came to actually implementing these things that she already knew. She was also facing from sleeplessness. She's like, my day is going a blur, they're hazy, I don't know what I'm doing, because I'm so sleepy the whole day. She was also, after I asked her about it, she said, yes, I have vaginal dryness. My sex is very painful, and because of the dryness, probably, I mean, she's like, yeah, keep on having these urine infections. So again, that awareness that yes, your vaginal dryness is because of your menopause, and it's a symptom which typically occurs more after you've had your menopause, and this is what leads to recurrent UTIs. And the treatment of UTIs, while it can be that acute treatment when you treat the infection itself, there is something which we can do beyond that, by preventing that vaginal dryness, which will in turn prevent her UTIs. So that was some kind of knowledge which was which she felt was, oh my god, I'll be so happy if I stop these UTIs, because they are constantly that urination, that pain and all that she was having. And that was something which helped her when she got aware of all of this. So again, this lady, next slide. So this lady also, what did she need from us? She needed an awareness of the fact that yes, my UTIs and my vaginal dryness is related. She needed people around her to understand her. She needed some support. She needed an empathy, and she needed a choice to treat herself. She wanted to know that what choice do I have? What can I do about this? What options do I have? So it's also important to, I mean, if you know the options of treatment that you have, then you could actually go ahead and say that yes, I want to go for this treatment. So that choice also has to be the woman's choice, where she can decide for herself that yes, I need to solve this, I would like to go for this treatment, or I would not like to go for this treatment. That also, of course, the doctor will have a say based on other things that you sometimes have to rule out. Like suppose you want to go for hormone therapy, whether you can go for it, cannot go for it, that is something that the doctor will decide. But yes, that choice has to be given. I mean, in 2022, we want that choice to be given. We don't want doctors telling us that you have to do this. It doesn't work like that anymore, unfortunately. Or I mean, fortunately, I would say. Next slide. So one more lady would come to me. She was 38 years old. She was a teacher by profession. She had a daughter who was 10 years old. And she told me she's having a lot of tiredness, and she keeps getting angry at her daughter. And her, I mean, it's affecting the relationship uh, between herself and her daughter, that she's getting angry all the time, and her daughters are getting scared of her now. So she's like, I don't know what's happening with me. My periods are regular. So could it be perimenopause? She read about the symptoms of menopause somewhere, and she wanted to know whether it is what she's going through. Is it menopause? So two things here. She's 38, so probably she was perimenopausal. So yes, that could be one reason. Again, like I said, there's no way you can point out or diagnose. Yeah, this is because of your perimenopause. What is most important is to feel better. So you are 38, you are in the prime of your life, and you really need to lead a happy life where you can have solutions for whatever you're suffering from. So it could be midlife, it could be perimenopause, it could be menopause. Labeling what it is not important. Solving for those problems is what is important. And the fact that you know that this can have solutions in different multiple ways is what is important. And again, what did she need? Also, she also needed to get some help. Next slide. She also needed to get learn to ask for help from people around her. She needed people to be empathetic, and she also needed people to understand her. That she needed, of course, you can't expect your daughter who's just 10 to understand what you're going through. But I mean, when I told her that, why don't you talk about it, that yes, mama is going through a problem, and she did. And she did speak to her daughter, and her daughter kind of started taking care of it. It was such a lovely this thing to hear from her. It's like when she's like, I told my daughter that your mama is having this problem, and she's like, my daughter now comes and asks me, are you feeling okay, should I do something for you, should I do this work for you. It was, I mean, educating your children to be empathetic, whether it's a girl or whether it's a boy. It was such a lovely thing. She's like, yeah, I was so happy that seeing whatever response I got from my daughter. So, I mean, if you can actually educate your kids at this age that yes, you need to respect people around you, and you need to, empathize with them. I think it can go a long way in removing this taboo and this problem that we are facing. Maybe 2050, when we have all those many billions of women who are going through menopause, probably it could be the picture would have changed, and people are talking openly about it and seeking help for it openly, about for menopause. I think I look forward to that kind of a 2050, rather than having so many millions and billions of women just suffering through menopause. So after we have discussed all of this, we want your 2 minutes of time. We want to hear from you, from to yourself. We want you, next slide. We want you to ask these questions to yourself. Think about it. Are you assessing yourself often? And that assessing is not just physical assessment, not just doing those that yearly blood tests or that yearly checkup that you get done at your corporate insurance, this thing. It also means assessing yourself mentally, emotionally. Are you leading a good emotional life? Are you happy? Do you need help? When I talk about help, it does not just mean help, professional help from gynecologists, but do you need help from any mental health professionals? Do you need any counseling to be done? There's no taboo. Just as there should be no taboo in discussing menopause, there should not be any taboo discussing the mental health effects of menopause. Just like you treat your body, your mind is a part of your body. So do you want to, are you assessing yourself? Do you need help in that? Are you sleeping enough? Do you need, is your work getting affected because your sleep pattern or your sleep quality has degraded? Again, are you getting those regular checkups that you need? Is your partner aware of your symptoms? I think it's a very important question. Women are not aware. Like I said, men are more unaware of all of these things that women are going through. So is your partner aware? Have you spoken to him? Have you, I mean, this is also something that we face often, that women say that, oh, my husband to samajhta nahi. He says, I think somebody has written here, and I feel lazy, or I have become lazy. So it's not that you have become lazy, it's those hormones doing that to your body. I mean, it, talk about it, express yourself, open up about it, talk to your, I mean, sometimes when husbands come and listen to the conversation or to the consultation, they kind of understand, oh, I never knew my wife is going through so much, I never knew menopause entails so much. And people do understand. Yeah, they don't understand, yes, Sarla, but if you can, we can at least make an attempt to make them understand that yes, this is something for real. This is not something only on paper or in books. It's something that really happens when to women around them. Are your co-workers respectful? Are your colleagues also listening to you? Are they also understanding enough about whatever you are going through? And then I think it comes to the most important question, that comes out of all that we've asked ourselves and what we've learned from today. Next slide, Richa. So that most important question is, do you need help? Think about it. Don't just say, no, I'm fine. Don't do that. Do you really need help? Do you need to understand? Do you need someone to support you through this journey? Do you need someone to empathize with you in this journey? I've also had patients who have told me that I've gone to my doctor and my doctor said that uh, this happens, this is menopause, थोड़े time में चला जाएगा. So that is not what should be the approach of healthcare professionals to this phase of life.